Dr. Irfan Malik has been a GP for 22 years. He's learnt to rely on his instincts, and for some time his instincts have been telling him that his patients from Black, Asian and minority ethnic backgrounds are more likely to be affected by coronavirus.
And when did those symptoms start?
And today, confirmation in the form of some startling research from the Institute of Fiscal Studies, which has found that the death rate amongst the BAME population is more than twice that of whites.
Now we've got some firm evidence to back up our concerns. This is where it can have an impact, and this is where actions can happen either from a government level or from an NHS England level to try and reduce the risks for the BAME staff on the front line.
Recognising these concerns, NHS England bosses have this week advised hospital trusts to risk assess BAME staff and reassign them from frontline roles if necessary to reduce their risk of contracting the disease. The new research is significant because the IFS has taken into account age, gender and geography. They've found that if you take two people of the same age living in the same local authority, a Black Caribbean would be 1.7 times more likely to die than a white person, a Bangladeshi twice as likely, a Pakistani nearly 3 times, and a Black African 3.5 times more likely to die than a white person. Why is this happening? Well, there's unlikely to be a single explanation. According to the IFS, different factors will be more important for different groups. For example, Black Africans are more likely to be employed as frontline key workers, and some older Bangladeshis may be more vulnerable because of underlying health conditions. We also know that inequalities play a big part, as well as the experiences that some BAME patients have had when trying to access healthcare.
We also have some data that show that patients of Black and ethnic minority ethnic groups are undertreated for pain. We know that when patients hear this and read this, they feel they lack the trust, they feel that they don't want to come in and see us because they feel that they're not going to be listened to or their case is not going to be given the priority that it needs. I see this every day and I try my best to engage with these sort of patients.
Today's research has come after sad news of yet another doctor who has died. Dr. Nazir Khan, who worked at Dewsbury District Hospital, was described as compassionate, humble and loyal.
On a daily basis, we are seeing doctors, nurses, care workers from various ethnic minorities being affected, and it is very sad. I have been quite anxious, and to be honest, I'm thankful for every day that I wake up well, without a temperature or a cough or any breathing difficulties. So I'm very thankful for each day.
The government has ordered a review into the disproportionate impact of coronavirus on BAME communities, although it has yet to reveal the terms of reference or timescale. Darshna Soni, Channel 4 News, Nottingham.
Well, joining me now from Birmingham is Kahinda Andrews, Professor of Black Studies at Birmingham City University, and from Buckinghamshire, Dr. Nigat Arif, who's a frontline GP. Thanks very much to both of you for coming on the programme. Let me start with you, Professor Andrews. I mean, the evidence in Darshna's report was pretty conclusive and also, pretty damning. Were you surprised by what you found out, by what she found out?
I think the real surprise is that anybody is surprised. I mean, if you look at most areas of healthcare, you'll find that there's significant disparities for minority communities. And when we see these things happen and coronavirus happen, we have this kind of idea that the virus doesn't discriminate, we're all in this together. But really, it's just unveiling the true realities of our society. And racism is a matter of life and death. These kind of disproportionate things we see in all areas of social life, and we should not be surprised at all at these figures.
Dr. Arif, do you agree with Professor Andrews?
Yeah, completely. I think what coronavirus has done is just put a mirror up to society to say that there are all these health inequalities, because we have known about them. In fact, earlier this year, the Marmot report that came out showed that from birth to life expectancy, there's a 12-year disparity and there's a north-south divide as well. So I agree with the professor. I'm surprised, people are surprised that there are all these health inequalities. As a GP myself, I've been going on about health inequalities for about 10 years in my local area, and that's over crossing, gender, so women's health in particular, In fact, in 2019, the maternity report that came out showed that Africa, Caribbean Black mums were having far more complications in their births. So this is not a surprise. It's sad that it's taken a pandemic for us to recognise this even further.
Right, but there are significant differences within the BAME community as well, aren't there? Certainly also in terms of income.
Of course. I think the most difficult thing that we're finding ability to grasp at the moment is the fact that we are getting doctors, healthcare professionals who are meant to be middle class or actually earning a little bit better. And that's what's really thrown everybody. We don't know what the underlying reasons for that is. Socioeconomic obviously plays a huge part. And obviously, if you are having more Black, Asian ethnic minorities working in a face-to-face role, so they're your taxi drivers, your shopkeepers, they are your cleaners at the hospital, they're going to have more face-to-face roles and therefore more exposure to coronavirus. We still need all the research to come forward to be able to actually get to grasp of what's going on.
And Professor Andrews, these could be not just social reasons, could they? They could also be medical reasons, like a propensity for certain kinds of diseases like sickle cell.
Well, I think we find that the actual evidence around this is, if you look around the world, when you think about genetics and skin color, there's no evidence at all of that. There is obviously, if you have an underlying condition that has been seen to be something you're more likely to die from. But again, Black people and Asian people in this country are far more likely to have underlying health conditions. And that is, I'm sorry, a social issue. All of this is really explained by the position which we find ourselves in this society. And we shouldn't be surprised also that in America, we're seeing the same thing. Ethnic minorities far more likely to die, catch the illness, get sick, and to die. This is a symptom of the racism that is deeply embedded into our society.
Right. Now, Dr. Arif, we tell people over the age of 70 to stay indoors. We tell people with pre-existing medical conditions to stay indoors for longer than perhaps the rest of us. What should you say to someone watching you tonight, watching this program, who is from the BAME community and feels that they're particularly vulnerable? Should there be special measures?
Of course, I think that your report really clearly said earlier that the hospitals and line managers need to be actually talking to their staff and risk assessing those from Black, Asian ethnic minorities. If they do have underlying heart condition, they have respiratory conditions, diabetes, immunocompromised, they should be stepping away or maybe reassessing their role in order that they don't have a face-to-face contact with too many patients. In the community, it's the month of Ramadan. And I would appeal to all Muslims who mostly come from Black, Asian ethnic minorities to please, if you do have an underlying condition, you're pregnant, you're nursing, you are on the at-risk group or shielding, please even refrain from fasting this year and make it up in the shorter months. And that, my advice would go to my colleagues who are working in hospitals, because being under PPE, that PPE can be really exhausting and be high risk of dehydration. So let's just take away some of those risks that we're doing. Work with what we have available at the minute.
Professor Andrews, should the government be stepping in here directly and saying this particular group of people have to be treated in a different way because they're more vulnerable?
Well, I think the problem here is there are no simple solutions. And what the government tends to do and what society tends to do is when we have these crises is we do a report, we maybe get some token figure to look into it, and then we make some short-term recommendation. This is a long-term problem. Centuries of history have produced these issues. You think about NHS frontline workers, that goes back to 70 years ago at the founding of the NHS. So there are no simple solutions for this. What this should tell us is that racism, we need to take it far more seriously, deal with it as the matter of life and death that it is, and have a much more honest conversation about just how deep-seated racism is in all of the institutions in the country.
Dr. Arif, in 10 seconds, what should the government be doing?
Well, definitely be actually getting up to speed with our PPE in order to safeguard our frontline workers, making sure that our healthcare they are getting all the appropriate equipment. And most importantly is being honest about where we are with the situation and getting that investigation into deaths in BME communities underway far, far quicker.
Okay, Dr. Arif, Professor Andrews, thanks very much for coming on the program. Krish.